Recently, there is a tragic news that several doctors from Princess Margaret Hospital has been infected by a particularly sinister strain of bacteria which produce a toxin which is very dangerous. And unfortunately, one of them died of the disease. It sounds really scary. I'm sure most of you have received some information about this infection from the media, but the jargons or the medical terms sometimes is very difficult for ordinary people to understand. Now, I'm using this video to try to explain in very simple terms that what kind of infection it is and do you have to be afraid of it. Now, the bacteria causing this tragic event is called E. coli. I am sure most of you have heard about this common bacterium. Like the coronavirus in COVID, there are many different strains of E. coli. Some of them are quite harmless, but a few of those among this group of bacteria is very dangerous. The bacteria in this case is what we call shiga toxin producing E. coli. Shiga toxin is named after a doctor named Shiga, a Japanese doctor in the 19th century. He found that certain strains of bacteria, including the E. coli, can produce very dangerous toxin, which is hazardous to the health of human beings. This kind of toxin-producing bacterium is normally present in the gut of farm animals like sheep and cows. In the case of farm animals, this kind of bacterium will not cause any problem. Usually it's no symptom at all and it's not going to cause any disease among farm animals. It follows that the excreta, the stool of the farm animal, contain this kind of bacterium. If accidentally human ingested food or water or any produce from the farm that has been contaminated by this kind of bacterium or have been in contact with the excreta of farm animals, there might be a huge problem. Now, this kind of bacterium once enter into the human gut, the toxin it produces will cause cell death of the gut in humans. And if the toxin get into the bloodstream, it will cause damage to the inside lining of many small blood vessels, or what we call capillaries. Now, normally, the inside lining of our blood vessel, including the capillaries, are smooth. But in the case of cell death or damage caused by this toxin, the surface of the inside lining of blood vessel will become irregular. It becomes rough. And whenever this happens, this is a strong trigger for the clotting cascade or clotting reactions. That is to say, it will trigger widespread clot formation inside our blood vessels. In that case, what you can imagine is that the small blood clot will follow the bloodstream and go into the capillaries in our vital organs, blocking the supply of blood and oxygen. Of course, it will come with severe consequences with multiple organ failures. At the same time, if there's widespread formation of clots in our blood, then the platelet present in our blood, which is essential for clot formation, will be used up. That is to say, the level of platelet will go down quickly, with a result of bleeding tendency, so the blood cannot clot anymore. In addition, the rough surface of the blood vessel, together with the clots inside, will cause mechanical damage as our blood cell is passing through. For example, the red blood cell will be damaged. It's like cut by scissors. Many of the red blood cells will burst, and if that happens, if there's a widespread phenomenon of bursting of red blood cells, then we lost the medium to carry oxygen to our vital organs. Now, a little bit about the symptoms. If someone has been infected by this kind of bacteria, like after 3 days, there will be stomach cramps or diarrhea, and because there is cell death in the gut, then the stool is likely to be blood stained, or there might be blood in the stool. And if the condition is not improving after 7 days after the onset of diarrhea, then the clotting problem, the anemia will result. And this toxin has a preference for the blood vessel in our kidneys. So there would be widespread damage of the blood vessel in our kidney, together with the blood clot formation there. There will be acute renal failure. That is to say, our kidneys cannot function anymore. You, sufferer of this condition, will find there is very scanty urine. They don't have to go to the toilet as frequently as usual. Because of the acute anemia, the patient will look very pale and is very weak, very tired. In addition, the no blood platelet or the bleeding tendency will cause bruising in the skin, or there might be some red rash in the skin, which indicates bleeding in the subcutaneous tissue. And of course, at this stage, you can expect it can be very dangerous and can be fatal. Well, a little bit about the prevention. Usually, the source of infection will be food that has been contaminated by the bacterium. The food that are more prone to be contaminated include ground meat, like ground beef or ground lamb. And in 1982, there is a series of cases of undercooked hamburger beef, which cause a series of infections, including some fatalities. If you consume ground beef, make sure you cook it properly. And avoid raw milk. Raw milk has become very fashionable nowadays, but unpasteurized milk may contain this kind of bacterium and carry a higher risk of spreading infection to humans. And water like in the river or in the lake, you can never be sure whether it has been contaminated by wastewater by some farms upstream of the river. They never drink water that has not been treated properly. Some people would like to know whether this infection can be spread from human to human. Yes, it can, but it usually occurs in a context like sharing of toilets. If you have contact with surfaces inside the toilet that has been used by a patient, and if you don't wash your hand after going to the toilet and then grab some food and take it, then you might be infected. To prevent getting an infection from the toilet, make sure you wash your hand after using the public toilet. Well, I think that's about it for today. Thank you very much for listening, and please like, subscribe, and give your comments. My new book, Dr. X Medical Kindergarten 2, has been published, and you can get it from the major bookshop in Hong Kong. And if you are from overseas, you can order it through the HKTV Mall website. Thank you very much for listening. I'll see you in the next one.